is Dr. Riva Preil of Revitalize Physical Therapy. I am a pelvic floor physical therapist, and I'm so grateful that Nishmat has given me the opportunity to share information with you via this TED Talk. Today I will be speaking about proactive pelvic health. The pelvic floor is a group of muscles that sits at the bottom of the body. You could think of it as a sling or a hammock that runs front to back and side to side. The pelvic floor muscles serve three primary purposes. Number one, these are the muscles that are responsible for bowel and bladder continence. Number two, these are the muscles that help support the organs of the pelvic floor. And number three, these are the muscles that are responsible for sexual functioning. When the pelvic floor muscles aren't functioning as they should, that may manifest as bladder, bowel, and/or sexual dysfunction. Let's discuss each of those categories one by one. Bladder dysfunction may manifest as urinary frequency, which is the feeling of having to go to the bathroom very often, urinary urgency, which is the feeling, a strong sudden urge to urinate with very little wait time. So that's the feeling of I have to go and I have to go now. There may be urinary retention or incomplete emptying of the bladder. And very often people will report that they have to urinate 10 minutes after they've just gone to the bathroom. That's generally an indication of incomplete emptying of the bladder. Other bladder symptoms that people may experience are burning or pain during urination, hesitancy, which is difficulty initiating the urine stream, or urinary incontinence, which is involuntary loss of urine. People may also experience bowel symptoms, and that can present as frequency, just like with urination. They may experience incomplete emptying of the rectum. They may experience fecal incontinence. There may be pain while passing a bowel movement, and there may be constipation and/or diarrhea. There may also be abdominal pain. Sexual dysfunction may manifest as pain during initial insertion and/or during deep penetration. There are many different possible causes of pelvic floor issues. Pelvic floor dysfunction may develop as a result of pregnancy, labor, and delivery. Those are generally associated with weakness of the pelvic floor. There may also be previous history of trauma or abuse. There may be history of urinary tract infections or yeast infections. Any gynecological cancer or surgery could contribute to pelvic floor muscle dysfunction. People have endometriosis, which is a gynecological condition during which the endometrial lining grows outside of the uterus instead of in the uterus, and that can cause the pelvic floor muscles to tighten. People may also demonstrate tightness in the pelvic floor muscles for no seeming apparent reason. It might just be their body's natural storing pattern of stress and tension. Some people store stress and tension in the top half of their core, say in their neck or their shoulders. Other people store stress and tension in the lower half of their core, in their pelvic floor muscles. And in that case too, it would be appropriate to participate in stretching exercises to help release the tension and tightness that exists in those muscles. We also like to say as pelvic floor physical therapists that sitting is the new smoking. No one is meant to sit for 8 hours a day while working. The body was not designed for that. And sitting for prolonged periods of time, especially with a leg crossed over the other one, can contribute to pelvic floor muscle tightness. Therefore, I encourage my patients to get up and walk around every hour and a half to 2 hours to take a standing break, a walking break, to get those muscles moving and allow the pelvic floor muscles to lengthen. In general, we like to categorize pelvic floor dysfunction into two different categories. There can be underactivity of the pelvic floor muscles or overactivity, and you could think of them as opposite ends of the spectrum. With underactivity, the pelvic floor muscles are stretched, lengthened, weak. So think of pregnancy, postpartum. That's generally where we see weakness within the pelvic floor. The opposite end of the spectrum is overactivity of the pelvic floor muscles. That's where the pelvic floor muscles are too on, or think of them as being in a state of tightness or spasm. In that case, an individual would benefit from stretching, releasing, and lengthening the pelvic floor muscles. So sometimes when people come into pelvic floor physical therapy, they say to me, oh, if I have a problem with my pelvic floor, I should be doing Kegels, right? And the answer is not necessarily. If the person is experiencing just straight up weakness, then in that case, Kegel exercises or strengthening exercises would be appropriate, because when there's underactivity of the pelvic floor muscles, an uptraining program or strengthening program is warranted. However, if an individual is experiencing overactivity of the pelvic floor muscles, or tightness and spasm and pain in the pelvic floor, then Kegels would be contraindicated, and it would be inappropriate to perform them because they would further tighten the spasm and the symptoms that the person is experiencing. For a person who has overactivity or tightness of the pelvic floor muscles, we initiate a downtraining or stretching, lengthening, releasing program to help the muscles get back to a better resting tone. One of my favorite exercises that I teach pretty much all of my patients on day one, especially if they have overactivity of the pelvic floor muscles, tightness, pain, and I fear that they would have a difficult time tolerating the examination, is a technique called diaphragmatic breathing. Diaphragmatic breathing is basically inhaling slowly through the nose for 5 seconds and exhaling slowly through the mouth for 5 seconds. Diaphragmatic breathing benefits the pelvic floor muscles in 2 ways. Firstly, when one properly performs diaphragmatic breathing, it provides a gentle, subtle stretch to the pelvic floor, because as an individual inhales, the diaphragm descends, the pelvic organs and contents descend, including the pelvic floor muscles. They move down ever so subtly. When the person then exhales, the diaphragm rises, the pelvic contents rise, and the pelvic floor muscles rise and return to the starting position. So a gross exaggeration would be as follows. Inhalation is coupled with descent of the pelvic floor, exhalation is coupled with rising of the pelvic floor. So by performing breathing properly, a person can allow those muscles to move, provides a gentle, subtle stretch to these muscles. The second benefit of diaphragmatic breathing is that it shifts one's whole mode of functioning from sympathetic fight or flight response to parasympathetic rest and digest response, which means that it allows all of the muscles in the body, including the pelvic floor muscles, to relax and release. For more information and a demonstration on diaphragmatic breathing, I encourage you to check out my YouTube channel, Pelvic Pearls, where there are pearls of wisdom on various different pelvic floor concepts. And there's diaphragmatic breathing demo. There's also information about how to use a trigger point pull if you have tightness in muscles. And there's also a prenatal stretching program. Diet strongly affects bowel and bladder habits. There are certain beverages that are irritating to the bladder, which is also known as the detrusor muscle. And when the bladder fills with irritant, it causes the detrusor muscle to contract, even if it's not full. Common irritants are coffee, alcohol, carbonated beverages, artificial sweeteners, all the things that most people love to eat and drink. If a person is primarily consuming irritants, they will feel like they have to go to the bathroom when the bladder is not even full. I also educate my patients about the concept of bladder irritants. There are certain beverages that are considered irritating to the bladder or the detrusor muscle. So I'll tell my patients, sure, you want your 1 cup of coffee in the morning, I get it, so do I. But at least try to drink 2 cups of water to every 1 cup of coffee. So a 2-to-1 ratio of non-irritant to irritant, so that by the time the coffee reaches your bladder, it will already be diluted somewhat. In addition, I teach patients about normal voiding or urination habits. In general, it is considered normal to void every 2.5 to 3 hours, or 6 to 8 times per day and 0 to 1 time per night. Of course, another important piece in the conversation is what people are eating, namely fiber. I encourage my patients to consume 25 to 30 grams of fiber per day in order to have healthy bowel habits. It is considered normal to pass a bowel movement anywhere between 3 times a day to 3 times a week. There should be no straining or pushing for either urinating or passing a bowel movement. People will sometimes ask me, how do I know if it's appropriate for me to see a pelvic floor physical therapist? Some general guidelines that I suggest is, number 1, if a woman is engaged, is about to get married, and knows that she's never been able to comfortably insert a tampon because it's too painful, she stands to benefit from seeing a pelvic floor physical therapist. Number 2, any woman who's had a baby should see a pelvic floor physical therapist. As wonderful and beautiful as the miracle of childbirth is, it's also a trauma to the pelvic floor. In France, all women are sent to pelvic floor physical therapy after they go to their OB for their 6-week postpartum visit. Whether or not your doctor refers you to a pelvic floor physical therapist, I encourage you to be your own biggest advocate and to seek out a pelvic floor physical therapist if you have had a child. Number 3, anyone who can relate to or experiences any of the bladder, bowel, or sexual dysfunction symptoms that I discussed earlier probably stands to benefit from seeing a pelvic floor physical therapist. I appreciate the opportunity to share this knowledge with you, and I thank you for listening to my 10 Talk. If you have any questions, please don't hesitate to reach out, riva@revitalizephysicaltherapy.com. I would love to help in any way possible. Thank you.